Alright, everyone, welcome back. Picking up where we left off at yesterday. Vision or sight impaired individuals. Low vision can see, meaning that they can see a degree of light or some images caused often by muscular degeneration and or diabetes. Blind, all people who need alternative techniques to do the same task that a sighted person can do normally. Okay. Braille is a writing system for sightless individuals. Patterns of raised dots, read by touch. Long white cane and guide dogs. Patients who have visual impairments, when addressing a patient who is blind, speak directly to the patient. Do not raise your voice or speak to a companion if there is one. The patient cannot see you, so introduce yourself as you shake their hand. Again, just being mindful of the situation and the patient and their condition, and just think about how you would feel. If you were in their shoes, how would you want to be treated? And it just makes it a lot easier for them to identify with you, and for you all to be able to build that rapport. You're shaking the hand, letting them know that you're there, introducing yourself. If they have someone with them, you don't want to speak to that person, that other person, without indicating that's who you're talking to. Again, because that could confuse the patient. So just be mindful of that when we're dealing with a vision impaired patient. Patients who are blind entitled by law to use a long white cane or a guide dog. Move furniture or medications out of the way prior to venipuncture procedures. Let the patient know who is in the room if there are others present. Again, just when you go in the room, you don't want to just grab that chart off the counter or out the door and go in and just start talking with no evidence of no knowledge of what's going on with the situation that you're walking into. Want to make sure that if you're the person bringing them to the room, or you have to relocate them to another place, you want to make sure that you move all the furniture and stuff out of the way. Again, it's just common courtesy. We definitely want to make sure that any medication is in the way prior to you performing a venipuncture. Then you just don't want to run the risk of having something knocked over or broken, whether it be by you or them. Whether it's an accident or not, someone's going to have to pay for it. And the fact that you didn't take that you're the one in control in the situation, so that you might be the one paying for it. Okay. If you're the lead person there, you're training someone and you're bringing them in along with you to show them how to handle this situation, and just being courteous, and let the patient know that someone else is in the room with them. And that's a violation of privacy. So we're still working on being confidential with the patient's information. So pay them their respect and let them know if someone else is in the room with them. Okay. Describe all procedures thoroughly and offer to answer any questions. Do not ask questions because you are curious about blindness. Do not make small talk about patients' other senses. Most people who are blind do not want to be fussed over. And just common courtesy. It's no secret, everyone knows that if you lose one of the five senses, the other ones become heightened. Okay, so you don't want to go in and be talking to them, being starstruck. Oh my God, you can't see. Can you smell everything? Like, are you more sensitive to touch? That's just gonna make them extremely uncomfortable. That's very unprofessional. So you just want to cut out on that. Okay. Again, make sure you explain to them, walk them through every step of the process, and just so they'll be in the know. Being courteous. Hey, pace, tone, and volume of the voice. Pace is the rate of speed and urgency. Tone is the pitch of voice or tonation. Think about like a high soprano or a low baritone, okay, or a tenor. Volume is the range from loud shouts to soft whispers. Okay, make sure you guys study this. Make sure that you know the difference between um, tone and volume for sure, because you guys will see that in the future. So make sure you take time to learn the difference. Right. Urgent situation, usually were for a high-pitched, rapid-paced voice. Um, Sarcasm done by changing the tone of your voice. Practice using a calm, soothing, um, moderately paced voice. You see that done in table 2.2 in the textbook. Um, and if the situation is urgent, like think about like a kid or someone that is panicking. Probably easier to notice it in a woman. Like if there's a serious situation, you probably can see the you can recognize the difference in her voice. Um, Pretty sure everyone knows someone that is sarcastic, so you can tell the difference in their voice. Or you tell someone a joke, it's like, oh, that's real funny. You can sense the sarcasm in their voice. Okay. Um, you want to make sure that you practice using a calm, soothing, moderately paced voice. Okay? If you talk loud and you've been doing it all your life, yeah, that's fine. But again, you want to make sure that you are in compliance with the rules and regulations of the building, and in compliance with the law. Because you don't see a problem with your voice, someone else may interpret your voice, your tone of voice, or your volume to be offensive. Right? So you can just be mindful of that. Right. Nonverbal communication. Everything that we talked about on the verbal end, that seems like that's a lot. It actually only makes up 7% of communication. The other 93% is nonverbal communication. Right? Positive body language aids in communication, makes patients' interaction more pleasant, face-to-face positioning, relaxed hands, arms, and shoulders. All these things make people feel more comfortable. Okay? Erect posture, meaning you're sitting up straight, eye contact at eye level, so you're smiling, so you're in your comfort zone, or you're not breaking their comfort zone. You see that on table 2.3 in the textbook. Different the zones of comfort. You have your intimate space, which is close relationships, whispering, embracing. Healthcare workers who bathe, feed, dress, and perform venipuncture. You're going to be operating in this intimate space, a personal space. Interactions among friends and many patient encounters. Social space, interaction of everyday life, public space, lectures, speeches, and concerts, etc. Okay. Culture, values, which are accepted principles of a group, beliefs, which are doctrine, faith, and spiritual orientation, traditions and practices, which is customs, holidays, food, music, dance, arts. Um, so you just want to be mindful of all of these things, because again, we are dealing with different people from different ages, definitely different ethnic backgrounds, and what may seem normal to you and your everyday life and how you were raised and your own customs, morals, and traditions may not hold true for others. So let's be mindful of that. Um, the rule of thumb is like when you out to eat, like with some friends, or someone invites you over, they cook food. Even if you don't eat it, you would take a small portion of it to put on your plate and try it, just to, out of respect for them. Um, think about whatever your music preference is. You wouldn't want to, if someone told you that they don't listen to that type of music, you would want to respect them and not play the music around them, just like you wouldn't want someone playing something that you didn't like. Okay? Um, and it's just being mindful of of this of these things. I believe I said earlier. So if you find yourself interacting with a patient and they say they don't like you because of the color of your skin or your hair or the perfume you wear or whatever the case may be, you don't get bent out of shape about it. You apologize, bow out respectfully, and you move on. You have someone else to go take care of them. Okay? There's nothing that you can do. You getting bent out of shape is not going to make the situation any better. And they're spending their money, um, and so that's who the people are going to go with. Right? They don't want to lose any money, so if it came down to it between the patient and you, 9 out of 10 you can bet it's going to be you because you're costing them money. Right? Right here in Figure 2A, you see the nurse sitting down talking to what appears to be the mother. Notice how she's at eye level with her. Um, she has pretty good posture. Everyone seems to be engaged in the conversation. So this is what it should look like when you're interacting with a patient. Negative body language. Wandering eyes, yawning, stretching, nervous behavior, like tapping a pen, breathing patterns, crossed arms, wrinkled forehead, frequently glancing at a clock, and chewing gum. All these things are considered to be negative body languages. Okay, I think you guys hear me tapping this pen now. I'm pretty sure that is rather annoying. So you wouldn't want to do that when someone is talking. It's tapping a pen or constantly checking your cell phone. All these things are perceived to be negative. Okay, again, put yourself on the opposite end. How would you feel? Oh, it's just a cell phone and this and the third. Okay, that's great. You're right. It is just a cell phone, but I don't know what type of phone you have. I don't know what planet you live on, but I know my phone, it gives me a notification whenever something's coming on. If my phone it's like in sleep mode and it's gonna ring, it's gonna light up. Okay, so I don't have to keep checking it to see if the message is coming through. Okay, if the message comes through right then or it comes through later, the message is gonna come. All right, and there's no sense in sitting there babysitting it, waiting for it to come through. Because if it's that important, instead of you waiting for it, then you would call and you would call or send a text message yourself to ensure that you got the information that you needed. Um, but now all of this, um, there's a fine line between all of this. Um, so let's look at the breathing pattern. One way to get the employers, if you're an interviewer and you're trying to get a job, obviously. One thing that you can do is if you can mimic the breathing pattern of the person interviewing you, it shows that subconsciously that person interviewing you will see that you all have a common interest, and they'll be more inclined to hire you. okay? Because you seem like y'all would be in sync, all right? So it's all about just how you get up, how you approach the situation. Um, Even wondering eyes, and it might not always be something negative, yarning or stretching. It just could be like you're the person's getting comfortable. We talk about like crossed arms and crossed legs and things of that nature. It's a lot that goes into the nonverbal communication part. You don't want to just assume anything. You want to look at the person's tone of voice, their posture. What are they doing? What is the environment like? Okay, maybe it may be too hot in there, and heat does drain you of your energy. So that person could be getting tired. It's not necessarily that they're bored at what you're saying. Think find what you're saying is boring. So and just be mindful and take all these things into consideration. Right? We see here um, the nurse interacting with the patient, and this first picture, it looks like clearly you can tell that he's ignoring her. He has his back turned to her. So, right here, she's sitting there trying to tell him something again, and he just doesn't even look remotely interested. His body's turned away from her. Um, this part here at the bottom, I feel like this picture can be interpreted a couple different ways, but we're gonna go with what they said here is his demeanor is aggressive. So it didn't say if this is throughout the course of the day. Like he was ignoring her earlier. He's not listening to what she's saying here, and here he's to the point where he's just fed up with it, and so now he's getting aggressive with her. Okay? And then this in the last picture, you see the authoritative or power stance. He's standing there looking down on her with his hands on his hip, trying to make himself appear bigger than what he is. That is considered a scare tactic, like and you view it like you would like a cobra. When a cobra is just out and just minding his own business, it looks like a normal snake. But when it goes into attack mode and it raises up and it spreads its cape, like the exact that's what the power stance represents. Okay, active listening, paying undivided, complete attention to the guest, to the speaker. You want to make sure that you're ready, make sure that you face the speaker, pause occasionally, verify that you are listening, and avoid judgment. Okay, so I hope that you all would be setting aside time every day to do your work. Just like you get up and get ready to go to class, you want to make sure that you're getting ready for whatever it is that you're about to engage in, whether it be an interview. We definitely want to make sure that you're ready for that. Um, with us doing this distance learning, again, be vital to your success if you could just set aside some time to ensure that um, that you're able to take in everything that's coming at you um, with the work with no outside distractions. You want to face the speaker. Like if you're in the classroom, you would want to be sit in the classroom with your back turned to the instructor while they're talking to you. Okay, and that's disrespectful. Um, you want to make sure that you pause occasionally. And this goes for uh, more so on the end of if you are the one doing the speaking, make sure that you take frequent pauses just to give everyone a chance to catch up. Um, scan the scan your audience to what um, see what type of feedback you're getting from them in the nonverbal sense. You want to verify that you're listening when you're engaged in a conversation with someone. Um, one thing towards one some key components of active listening is nodding your head in agreement with things that they're saying and speaking. Speaking, let them know that you are listening. So just shaking your head, saying yes, okay, I understand. Just being engaged, and you want to avoid judgment. You never want to just think the worst when in a situation because you don't know, because everything is different with the, I guess, with the nonverbal communication. uh, like the standing there with your standing sitting there with your arms closed, it can mean that you are uninterested in what is being said, or you could find that to just be a comfortable position. So again, it's just a fine line between all this. So you don't want to pass judgment immediately. You want to make sure that you evaluate the situation in its entirety before you begin to um, think the worst. Okay? Um, Provide feedback and maintain eye contact. And that's what I was just saying with the active listening. Notice the body language. Use encouragement. Practice these skills daily. Okay? In order to be considered an expert in anything, you have to put in 10,000 hours. That's the mathematical breakdown on it. So that's essentially like 5 years. And I think that we've been communicating since the early ages of like maybe between like 6 months when you first start making real sounds up until however old you are now. But communication is one area where we often all struggle, right? And it's because we don't really practice it as much as we should. I think I mentioned earlier about um, how we do everything over cell phones. Everything is done via text message, and the only time we call someone if it's really important or if it's to argue with someone. Other than that, everything is just a text message, a post. Um, like we're really hurting ourselves in the aspect of communication. But again, that is something that we can. It's an easy fix. Only thing we got to do is just start practicing talking to people um, on a daily basis, and we'll get better at it. Written communication, the online and handwritten. This includes your schedule, your QC records, your laboratory reports, medical and inventory records, and make sure that the handwriting is always legible, and use permanent ink. Avoid using gel pens and felt pens and things of that nature. Because if you write on any of these QC records or label laboratory reports or medical records or inventory records with those pens, that ink can get smeared, and it just looks real messy. Makes it extremely difficult to read. So just be mindful of that. Family visitors and significant others, they can make patients more secure. Think about it, especially if it's a kid, like a younger child, possibly feel more comfortable being in the presence of their mother until a certain age, which we'll talk about that in one of the future chapters. Um, if they make unreasonable requests, inform your supervisor. Um, So leave that to the powers that be, the proper authorities. If they make a request that you feel as though is uncommon, don't try to deal with that situation yourself. Just leave that to the proper authorities. If several visitors are present, if several visitors are in a patient's room, they may be asked to step out while the vein puncture is being performed. And that's just common courtesy. Um, think about with the numbers that we have in our classrooms and the size of our lab. So I said, if we just think if we had a class of like 20 people and all of us were in there trying to get sticks or EKGs done to take blood pressures, going all of those people in there um, talking and going through the procedure, asking questions, things of that nature. It's a lot of noise in that, so you can't get an accurate reading when it comes to the blood pressure, especially with us doing it manual. You can't hear um, those beats. Um, and you're run out of supplies a lot quicker. And in the event that you are attempting to perform venipuncture on someone and someone's at the station beside you, someone could bump the table or bump you trying to get to the next section while you have that needle in your hand. And what if you accidentally stab the patient with the needle. That wouldn't be that would be extremely bad. So, and again, going back to the patient confidentiality and privacy, you wouldn't want to have. It's just best to just ask them to respectfully ask them to step out the room. Right? Be sensitive to patients' privacy and confidentiality and the presence of visitors. Do not reveal test results unless appropriate to do so. Physicians, priests, and chaplains have the right to visit privately with the patient. And I kind of touched on that first point. And so you definitely, to further elaborate on that, you definitely wouldn't want to share any test results in front of the patient's family. Let's say if the patient doesn't want the family to know, to keep down hysteria. Um, so yeah, just be respectful of that. Um, the doctor, priest, and chaplain, they, like I say, they can visit with the patient privately. You will want to go in, say, "Oh, I need to take these tests, draw this blood." Um, if one of these people are in there, let them have that one-on-one time with the patient, unless it is an emergency. Right? Right? If the procedure is timed or stat, apologize for the interruption, explain the nature of the request, and ask permission to collect the specimens. What I just stated. Families or visitors should not be permitted in a clinical laboratory. That is a no. Only authorized personnel should be in the lab. Okay. Right? When encountering a patient for the first time, make sure you introduce yourself and state that you are a part of the hospital, unit, or laboratory staff. Inform the patient that a blood specimen is being collected for a test ordered by the physician. Okay? And these things, this first one is why we have the rules in place that we have at the school. So we require you to make sure that you're in uniform, make sure you wearing the right color scrubs, make sure you have on the right color shoes, make sure you wear your name badge, so we can identify you as a Unitech student. Okay. Same thing within the hospital. It's a lot easier to identify who's on staff when we know what the staff members should look like. Okay. And yeah, just let them know why you're in the room. You and just walk in and just start drawing blood. They would think you would want to know if someone was coming to your room what their purpose is. So again, just out of out of respect, do the same thing for them, for the patient, provide them with that information. Right? And that's where we're going to put a pin in it and stop for today.